Hi, my name is Kathryn Zumberg and I'm with the Andrew Kukas Foundation for Social Anxiety. For this month, I chose an article for families as well as sufferers of social anxiety that focuses on the relationship between anxiety and work performance. This article was published in 2009 by Erickson and colleagues, and you can actually find it online under the research section. This article examined the relationship between anxiety and several different work outcomes, such as work productivity, self-reported impairment, interpersonal problems, and time missed at work. And they did this in a sample of people who were receiving treatment for an anxiety disorder. Essentially, what they were looking at is they wanted to see how the severity of anxiety was related to all of these different work outcomes. And the way that they did this is they actually contacted people prior to their treatment beginning, and then they assessed them on a variety of different work outcomes, and then they were contacted again 12 weeks after the treatment finished. Those that agreed to participate completed all those measures then a second time. There were a few different findings from this study that are important to talk about. The first is that they found that those with more severe anxiety experience greater work problems, basically saying that the more anxiety you have, the more likely it is that you may actually experience some difficulties at work. They found that the people in this study experience problems like impairment at work. They had some impairment due to health problems, interpersonal problems, and that was really an interesting finding there. In addition, they found that the groups didn't differ based upon the type of job they were in or their job satisfaction, which are other reasons that individuals might struggle at work. And so essentially what this means is they found that people that had higher anxiety versus lower anxiety didn't differ in the type of job that they chose, so that wasn't the reason that they experienced more impairment at work. They also found that individuals who did not improve in treatment did not show any changes on these work outcomes, but they found that individuals who did improve in treatment showed improvement on several of the work problems that were measured. Overall, I think that there are a few important implications for this study. The first is that it suggests that people with anxiety disorders, such as social anxiety disorder, may experience problems at work that could be related to their anxiety. And these difficulties could range from things such as lower productivity at work, missing work or sick days, or struggles with other employees. In addition, the results of the study suggest that treatment of anxiety can improve these work outcomes, which may help people succeed in the workplace. If you're a sufferer of anxiety, you may be asking yourself, well, what does all of this mean for me? First off, it's important to say that the results of this particular study may not mean anything in particular for you, especially if you don't find yourself struggling at work. However, if you do experience problems at work, these results may help you to better understand some of the sources of these difficulties. It may be that a lot of your work problems are related to your anxiety symptoms and not due to any weaknesses or deficits that you have or don't have. Further, these results also suggest that your performance at work will likely improve as you make progress reducing your anxiety, which suggests that treatment is really important. If you are a family member who has a loved one that suffers from social anxiety disorder, one of the things that might be important for you to think about in terms of the results of this study is that if your loved one is experiencing problems at work or maybe at school, sometimes we can be hard on people and think that, well, they're just not trying hard enough. And this study suggests that it may be important to kind of take a pause and think about how it might actually be related to anxiety. And again, it's important then to support your loved one in terms of getting treatment and help for the anxiety that they experience. If you're interested in learning more about this study, you can find this in the research section under sufferers or family members for social anxiety and work performance. And there's a link that you can actually find this actual article for the study. All right, thanks very much, guys.